Hi, I'm Shaylin Garman and I'm making this video to inform others about kidney failure. First off, your kidneys remove waste and water from your blood to form urine. If this waste is not removed from the blood by the kidneys, it can build up in the blood and damage the body. You can get kidney failure by poor intake of fluid, decreased blood supply, dehydration, kidney stones, and medications are just some examples. You are diagnosed with kidney failure by getting a blood test measuring the buildup of waste products in the blood. There's only one way to treat kidney failure, by getting a transplant. If you don't get a kidney, you'll have to go through dialysis. And here's a clip of what dialysis is and some questions I got to ask about it.
That was awesome, Mom.
I know.
Let me get started. You doing the whole thing?
Mm-hmm.
Yes, ma'am.
What's that you're putting on there?
This is the betadine.
Okay.
The first one was the alcohol swab. This is betadine to keep any infections or anything. Nice clean teeth. Just let that dry for a couple minutes. Yes, ma'am. Oh, you did? Okay. Thank you.
That's the dialysis machine.
Now we got to insert your arterial needle in. Thank you. And just covering it with a picture. And do your penis. Now I'm about to put your hat on. Just keep it from guarding.
Yes.
And I'm about to set you in the machine now.
You know, the thing that, I guess got me the most about it is that, they're down in the Bye. 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 So, I hope, right?
I'm about to put you on the machine now.
Alright, now I can get this machine.
And you run for 3.5 hours. Came up at that time, 32.
Huh?
Is the kids, you okay with their full
Yeah.
time?
No, I can, the full time I can run.
Awesome. I got it.
Are you?
Got you started now. Hopefully on. That's it. It's up. Wait a minute. You all set? I just got to program your blood pressure. Is that right?
This is my face before dialysis. It's all swollen from the toxins. After dialysis, it'll come down, sure.
You want to photograph me? My best side is from my waist down.
I believe it.
You need ISO?
This one I'll take, but not ISO.
Okay, this one.
Are you videotaping your arm?
Yeah, my daughter has to do like a thing on kidney failure.
Oh, okay. Well, then I'll keep my voice out.
The site bleeds, so I have to hold a gauze on it. They'll take this one out next.
Okay, Bob's gonna check real
Then I'll have to hold it till the bleeding stops, and then I can go.
Hi, I'm here at Molly Bay dialysis unit, and I'm here with Karen, who's a nurse here, and I'm going to be asking her some questions about dialysis.
Okay.
What is dialysis?
What is dialysis? Well, patients that come on to dialysis because their kidneys are no longer functioning, and your kidneys clean your blood, and also your kidneys also excrete for the urine. Okay, so the kidney is no longer working. So what we do is we clean their blood with the dialysis machine through a dialyzer, and it takes out all the stuff that the kidneys would filter, and it also takes off any fluid that the patient has on.
Why is it so important to take dialysis?
Well, if they do not take dialysis, quite frankly, you'll die, because it's just a matter of time when toxins will build up in your body, and you will go septic and you will die.
Is there a certain amount of time this takes? Like how long would it be?
Well, everybody's treatment's different. It can be anywhere from 3 to 5 hours, and it's 3 days a week. Sometimes we might have to give them extra treatment if they're in fluid overload.
Can you take dialysis your whole life, or?
There have been people that have been on dialysis for over 20 some years. It just depends on how compliant the patient is and how well they take care of themselves. Some patients will get a transplant and then maybe after 10 years have to come back on to dialysis. So it's an individual case.
What type of equipment do you use to treat people?
Well, we have a dialysis machine, the K2. So you have to have the machine and then a dialyzer. Depending on, we here use non-reuse. There's places that use reuse where they reprocess it up to 6 times. We use non-reuse. The dialyzer is what takes the toxins out of the blood. It diffuses it out of the blood. Okay, so you have to have the dialyzer, the blood lines, and a dialysis machine. And also, there's fluid that runs through, bicarb and acid. You need those chemicals with the dialyzer to excrete those.
How do you clean this equipment?
How do you clean it? Well, we throw away the dialyzers and the blood lines. So every time we do a treatment, it's new. We have a bleach and water solution that we wipe down the whole machine with, the chair, anything that comes in contact with the patient. If it is something that you can't clean, we have to throw it away.
Well, thank you for
You're welcome.
answering my question.
You're welcome.
And that is all.
This is me after dialysis. My swelling went down my face, not as much because they didn't take as much fluid off of me as they should have. But they'll take the rest off Wednesday then. So that's it.